Share your thoughts on gut microbiome, the inner ecosystem linking health and environment.
Basically, I thought this is something parasympathetic state we are into it. Can I ask the organizers to keep the lights on? I'll just start with because all of you are going to practice, and every patient of you is important. And you know what? Why the patient comes to you, and what is the kind of thing what you are going to tell them is again a big trick. I just put up in a small two-liner song. You are ready for that? Yes. बात बिगड़ जाए जब कोई मुश्किल पड़ जाए तुम देना साथ मेरा ओ मेरे डॉक्टर जब कोई बात. The thing is, there is a real challenge, I can tell you, and let us try to do something, because your patients, they owe you a lot, they respect you a lot, and we need to work it out. I'll be talking kind of thing, and I'll try to interact with you. Most of the students are there. Somewhere I'm excited to share my things here. And yes, gut microbiome. Yeah, can we have the slides first? Gut microbiome. Always talk about historical importance. Before going to this historical importance, I would like to share what my grandmom has taught me. We are a generation of doctors in the family. She taught that I think that is a naturopathy principle. All of you must be knowing. There is a thing called Sir Thanda, that's called cool-headed, not like MS Dhoni. And pet naram. Pet naram means your abdomen should be soft. It should not be distended. And your the feet should be warm. The reverse thing is happening now. How many of you are using showers, hot shower, cold showers? Do you have all naturopathy? I learned naturopathy through a tough way, I can tell you, because I didn't have any background. Started working on some thing called autism, and that was thrusted on me. Then started going deep into that. Then I can always tell you, just by altering this hot shower and cold shower over the nape of the neck, I was able to keep my stress levels down. So there is a big text, doc. Your patients, your old people, what is the diet they have taken, what your grandpa used to have the diet, what was the things which were available. We need to go down deep, we need to research it. Please some lights on your backside. So we have to really deep dive. And yes, there is a issue at hand, because somewhere you are all talking about, all the social media is full of pesticide. There is a lot of people who are talking these days how to keep your gut healthy, what is the probiotic we have to. There is a lot of ads which are coming up. Kayam Chur, somebody is giving an ad so that this is a big kind of thing. It involves not just your health, it's involving a big money also here. It's such a big thing. So I want all of you, I can share these slides. I came here to talk concepts with you people. This is all, you can always get all this stuff in I can share my slides with you, not a problem. The concepts now, when we talk about the concepts, how many of you knew that stone grounded grains, what was that? Right? My grandmother, chakki piecing, there was a dialogue in Sholay, right? There used to be chakki, that is a stone roller, and used to dry like that. The people who used to get into the prison, they used to give that kind of thing. And Saas used to give it to Bahu to do chakki piecing, right? That kind of thing is, the change happened not overnight, over the years, and the mill came, and all of you know about that, what exactly is, I'm going to talk about this. This is it has become a big kind of thing. I get all this, now we are flooded with Ashirwad atta, there were different attas are there, right? Where once you mill this thing down out, all the germinal layer, everything is gone. This quote is from Jeffrey Balls. Everyone knows about this. Keep the whites off, refined, and but I can always tell you what we started putting a mantra during the COVID days as a kind of thing. I interacted with a lot of naturopaths. We tried to bring homeopath, we tried to bring Ayurveda and allopaths on the same table during this COVID. And just by following your principle, this particular stuff, no refined oil, no white sugar, we were able to, the outcomes of our patients were quite amazingly good. It looks so simple, but it makes a big difference. And I can tell you, going back to that particular stuff, I started, it was difficult for me to believe the people, because I used to, when I used to go to a shopping mall, something like that, trying to get a grocery stores and all that, somebody used to bump in the sense. So I used to look into what he's carrying in the bag, right? 12 cans of Coca-Cola and all that. And then he says, Dr. Saab, I am fasting, my sugars are not getting better. So the thing is, if we are into that particular thing, then I started talking about, I started asking the people, I practiced autism and all that, it was slightly tougher. We used to tell about gluten, creatine free diet, no milk and no wheat. So, Doctor, we are following. So then I started asking, you just get a snapshot of your fridge, open the door of the fridge and share a snapshot. And people were not ready to share that particular thing, what they keep in the fridge. Even I am not ready. Because there will be definitely some bread or whatever things wrong. But everything has to be. As a doctor, you have every right, because you cannot go to the home and all that, but your word counts. When you start putting that kind of thing, Mr. Kameshwarji is here, he has seen my clinic. I started talking to the patients who used to come with a plastic water bottle. They used to come with a plastic water bottle with the loads of reports in a plastic cover. They had been to 3-4 cancer hospitals and they come to us. Then I told my staff, don't charge this much, you charge double. And I jokingly told one of my police commissioners of his place, I want to impose a fine to the patients who are carrying a plastic water bottle. You people have every right, because if he or the patient is using that particular thing, we are not going to change anything. Plastic, microplastics, it changes your microbiome like anything. So processing of sulfur dioxide, I have kept this purposely, just see this particular, why this is important for that, because it pre-digested things. Ancient process, this is grains, we used to talk about rice, nanabettu, I'm talking in Telugu, waterlo nanabettu chiptam. So if this is soaked in lime and hulled means taking out that husk out of that, shell out of that. So this makes free niacin available. This grain absorbs more minerals, more calcium, more iron, copper, zinc absorption. Most of your problems are because of inadequate zinc nowadays. Almost all your neuro problems don't have to do anything. Just put a zinc supplement, proper supplement, and you see a difference in the outcomes. Copper, iron, everything is a thing. So you can always start with the right. You know what exactly we are using these machines to process and all that. Very good ads, pre-digested fiber biscuit, and there's a lot of fanfare about that. Really, it's not good at all. I think we need to look at that particular thing. I'll come to a very interesting point, because I started my work with something called autism. I still get challenged when people with dementia, people with Parkinsonism. I was surprised, one of my I cannot divulge the name and all that. At the age of 52, a surgeon has to leave his surgery practice because he was having tremors. So what is happening here? This is really, this problem is slowly and slowly increasing, and we will try to deep dive and try to understand what is this brain and gut communications. Gut-brain communications. So we used to talk about Sridhar, we used to take one, na gut feeling undira, na gut feeling undi India baga brain idtadi, right? So what is that gut feeling? Is it something? Yes, it is already told. Gut-brain axis, you have got some enteric nervous system. We, as a medical students, all of you had gone through all these things. We used to have CNS, central nervous system, peripheral nervous system. What is this enteric nervous system? I didn't hear during my medical MBBS days here. Even now students also, they don't have that. So you need to, I'm really happy to meet somebody like Raghavendra ji, who was talking about vagus, and his lecture went out for a bouncer for me, because that guy had so much to say, and I'm really happy. This is the things we need to connect now. Vagus is the most important kind of thing. This blood-brain barrier, you need to understand what is blood-brain barrier, what is that thing called leaky gut. We'll just go one by one, and I'll try to show you what significant things. Yes, I already told you there is a thing called neurodegeneration. You know what is the average American who is about 50 worried about? He's not worried about his bank balance. They have got good balance. He is only worried if he loses his Google Maps, how can he drive back to his home? It is on the rise here. Alzheimer's we are seeing in the early days. This is only neurodegeneration, and which is a big part kind of thing. And you'll see how it is related to the gut microbial activity. So I told about this, ANS and all that. Yes, something I learned about ANS is very important. I tried, there are some things I must acknowledge. Joseph Pizzerno, I just happened to take his book when I was 20 years back. I just happened to take his book, Toxin Solution, and I went through line by line, and I understood what is this. I can always tell you, Joseph Pizzerno is he started Bastia University naturopathic medicine, and it's kind of thing. I started looking at what is now Raghavendra is talking about that. He is talking about that amygdalite thing. I have never heard. I'm an avid reader. All this 1990 I completed my medicine. I'm always trying to focus into, got into radiology, got into something like autism, and I must say it like that because I started my work with autism because of my personal reasons, and slowly in my practice now I don't do any radiology at all. I only try to work on some areas where I can fix the person. Even if he is slightly better with some diet, it makes a big difference here. So this is how we try to work it out. Yeah, neural communication, vagus, 80% fibers transmit afferent gut signals. So what is your gut feeling, Sridhar? It is directly goes into the brain. Imagine, why do you go for a you hear a news, some unexpected news, something like that, and you go for a toilet. Have you heard about that? Have you seen it? Have you observed all the doctors here? Suddenly they go for it because there is a big kind of thing with this thing. All your this particular thing gets activated. There will be there people say, "Arey, there is some what is that called? Butterflies in the stomach." What is butterflies in the stomach? Again, this is this vagus and efferent things only. Enteric nervous system. When I started my practice, in the sense I started looking at my autism solutions and all that, I was told by Joseph Marcola in US, hey, you need to cut down wheat and milk. Then I said, what is this going to make? And I was very happy. came down and I was talking to a group of neuropsychiatrists as well as neurologists, so called. When I said I have done 90 cases of autism, we stopped milk and we stopped wheat, and outcomes are good. So everybody started laughing at me. One of the psychiatrists tells me, what do you think about yourself? You think milk is causing autism? So kind of thing is, the point I want to make here is, you need to think differently, and we were very sure, because what goes into your system can get into that. There is a thing called leaky gut syndrome, and from there peptides goes. Once you can, that's a very simplistic this one, and you can make, you get a very good dividends. The child improves in a big way. Endocrine signaling and all that, you know about this. I don't want to get into that. Sleep, anxiety. I just wanted to, and the last one, I'd like to focus on what is this word called glyphosate. Glyphosate, I think almost all of you know, and how this is creating a big nuisance out here. Microbial metabolites. How many of you know? One is omega-3, one is omega-6. Out of these two, omega-6 is so-called bad, and the third one is omega-9. You get something in the oleic acid and all that. What is the fourth? Fatty acid. Omega-3 is a fatty acid, and the fourth fatty acid is called short-chain fatty acids. SCFA. I can always tell you, if something would have been made amrutam, that this must be having that particular. I'm talking about butyrates and all that, right? What Krishnji used to take, that makhan, right? That is that butyrates. But kind of, we are just trying to extrapolate. So these short chain fatty acids are produced in the body through which way? Humans are incapable of producing that. So I'll just give an example. Try to understand the analogy here. You have a beautiful house, you have a 10-bedroom house, and you are staying in 3 or 4 BHK, and other 6 BHK you give out for rent, right? When you are giving this for the rent, you expect something like every month you get some returns. So in our enteric system, in the GIT, we have given Adi Day. Adi is rent out. We have given all the bacteria and all that, we have allowed them to settle at one cost. They are giving monthly rental they have to give, right? That monthly rental is short chain fatty acids. Your common cell bacteria, which is there in your intestines, they help you in making this particular stuff. So you are allowing them to stay, and we are in harmony. So what if we cut down water supply to that rented people, we cut down water supply, we cut down the lights? What is going to happen? They are not going to give any monthly rent, right? Your things will go, tensions will escalate. He says, I will not vacate. Oh, you need to vacate. Okay? The same thing is happening here. You are not giving the prebiotics. Instead, we are giving something like that stupid glyphosate. Glyphosate is one thing. Monsanto's, you know, glyphosate is one of the, I can say, the worst kind of thing which has been introduced, and the only problem with that is they said glyphosate doesn't involve, there is a thing called shikimate pathway through that glyphosate works. So that shikimate pathway, it cuts down the shikimate pathway, from there chorismate doesn't form. So there is a kind of this one. So our contention is, yes, it is not toxic to human beings, correct, but it is toxic to our tenants who are bacteria. So if that thing is, your bacteria, good bacteria in the intestines are getting killed off with this okay, then you are not having any short chain fatty acid supply, and your all things goes for a halt. We'll just take one by one. How many of you have seen Parkinson's patient? Parkinsonism? I must tell you, without seeing a patient, I can tell if somebody is Parkinson, he must be a non-smoker. How much I am confident about that, I can tell you later. But 99.9% of Parkinson's are non-smokers. It rarely occurs in case people who smoke. There is an enzyme, dopamine, what is formed, that breakdown, this is the issue. There is one more concept I would like to give you. We had seen people with vagotomy. Vagotomy was an olden day. We used to have gastric ulcer. With gastric ulcer, they used to do a They used to do a gastric bypass and they used to do a vagotomy. That was when we joined medicine, that was the only thing. Vagotomy and GJ vagotomy it was called. Almost all the people who got vagotomy, they never had Parkinsonism. This Parkinsonism is because of the intestinal enteric nervous system getting direct supply to the vagus. What happened here is studies were done and they have shown a lot of common things actually. It was all this toxins what we are talking about which passes directly into that, they were not found in the blood at all. They were passing directly because there is a breach in the blood-brain barrier and it was passing through the vagus. And again, this is a blood-brain barrier. It was a favorite examiner question for us and all that. So how do you bypass is putting that particular thing through the nose, you bypass a thing. But these are the important things here. This is gut-brain. I'm really, because what happens is that what irritates, it's not the question of irritation. When we started talking about autism, when we started talking about other neuropsychiatric problems, degenerative things and all that, there is only one way. Now the people have decided. There is a call to me from Bhaiya. There is something like thing. We are going to neurophysician. You suggest what is the best neurophysician, and it is this kind of things comes to me from my classmates also. We want the best neurophysician in the Hyderabad. What is your problem? No, he has some kind of neurodegeneration. So the question here is, this has to be taken as a holistic view. What Raghavendra has told, we have to see that person starts meditating. It has to go with the holistic whole kind of thing. This GI tract also has to be. Stupidity. Oh, gas, flatulence, you go to a gastroenterologist. Nowadays, people are not coming to a family doctor, sir. They go directly. They look at your Google score. They look at how many ratings you have got, and they go there. Everyone wants to. I think most of you have not come to practice, and you will realize what I'm talking about later. This was the enteric nervous system I was talking about. How much time I have got left here? Neurotransmitters in microbiota is plenty. We have all this particular stuff. 90% of the body's serotonin is produced in the gut. What we have realized is the common presentation, be it diabetes, be it any kind of thing, any 40 or 50-year-old person comes, he comes with two main symptoms. One is constipation, second one is loss of, he doesn't sweat these days. So this constipation, unless you correct the serotonin in the body, it's not going to be good. You give any kind of things, the colon goes into a spasm. Gut, brain, leaky gut, as well as blood-brain barrier. I dealt enough with that, and I'm just trying to understand why there are so many cases of depression. Why this people have got into zero tolerance. Everyone is not lucky to get this kind of place to live, and this is certainly a very amazing place. And yes, but when we go into the roads and we see the kind of thing. It's really it unnerves you sometimes. If you drive in the Hyderabad roads, you will understand what I'm talking about. So all these things, they have a common denominator, which is the dysbiosis. Dysbiosis, again, it took us a long time to understand that, because we are talking about this is something like your this whole intestinal tract is like a forest here. And we cannot just pinpoint one weed or one thing and tell that, okay, I have given this antifungal, everything is good. It doesn't happen that way. You have to look as a whole kind of thing. And gut microbiota and health and disease, I can name every disease linked to that. Let it be your heart problem. There is a thing called periodontitis, gum inflammation, which gives rise to a heart attack. There is a studies which have already proved lot of cases. We have now with diabetes also, we are seeing there is a kind of there's not good things here. There are I think I should invite Kamesh here. He will teach me about gut this particular. You were telling about some author, no? Which book? Okay, because I learn a lot from my patients, and I really respect them because they give me that particular stuff. So, gut first hypothesis in Parkinson disease, and still we are not ready to accept that. We are bombarding the patient with dopamine and all that, and least is talked about, and something has to be done. Parkinson disease, Alzheimer's. And there is one more factor which I'd like to open up. I have not written here, which is causing this increase in resistant organisms. There is a thing called mycotoxins. Mycotoxins are because of fungal issues, fungal problems, and all that. Wherever there is some kind of you happen to take some today, you must have had some good sweets and all that. Satyalakshmi was telling me, why don't you have sweet? I said, okay, I don't want to have a sweet. My mycotoxins will start increasing. Thing is, why this has resulted this particular time, usually, we have never seen, we used to have a lot of resistance, antimicrobial resistance is on the highest level. And I certainly, I'm a fraternity, I'm a doctor's fraternity. I'm not going to take that narrative that, patients are taking excessive antibiotics, this is the kind of thing. You have any reason, other persons have any reason why there is AMR is so high? AMR, antimicrobial resistance, is a really burning topic, I can tell you. We cannot just go without that. It's all because of this particular. AMR is because of your poultry industry. You have, how the chickens, broiler and all that are kept. They were fed with lot of stuff. One of the stuffs are this particular stuff. To increase the muscle mass, there is a thing called roxason is injected, sir. They give a lot of antibiotics to see that chicken mass is good. Similarly, we have something in paneer, we have something in this particular stuff which is having, they are treating that with antibiotics, and that is, even if you don't take any antibiotic for the last 4 years, if you just go and take that chicken or any paneer and all that, your bowels are getting that antibiotic. You see, so maybe we need to be careful about all this stuff. It's a big thing in educating the people. Needless to say, you have any doubt or any question, please ask us. As a speaker, I believe that if you have questions, I'll be the happiest person. I'm just trying to give food for thought. I'm not trying to, this multiple sclerosis, we have never seen during our MBBS days. What we have seen in MBBS days are just few diabetics. We used to have tuberculosis. We used to have only that particular infective pathology. Now, where is that tuberculosis? Yes, that is there, but the other things which have gone up like anything. Multiple sclerosis, I have not heard about that. Now, I'm getting patients with ALS and multiple sclerosis. They just think that I have treated one MS patient with some hyperbaric oxygen. He started walking. Everyone is trying to flock. Difficult thing was shoulder dukh jata hai, mushkil hai chalana. So this microbial, again, multiple sclerosis has got that. Everything has to go. You need to have all the basics right, and you can always work it out. And you have sufficient data that the short chain fatty acids deficiency gives rise to this particular problem. How many of you are aware cesareans versus non-cesareans? How many kids are getting into a problem? If the child is born cesarean, he is deprived of that bacterial flora, what is being there, and he will be definitely getting into a problems now or later. The normal childbirth gives a kind of thing, as same thing as breast milk. If the child is properly fed with the breast milk, we can get away with some of the nasty vaccines what we are talking about. I must tell you, I'm not a anti-vaccinist, but what I have seen is enough of things. Why you should question why your child is going to be given hepatitis B at birth. When you are hepatitis B negative mother, why do you allow this hepatitis B vaccine to be given to a child? You have to stand up and resist all this stuff. Why? What is the need for? I don't want to enter controversy, but already this controversy has been raised, and as a doctors, you have to take a stand. I have been talking to a group of pediatricians. I have spoken to them. They have become anti to me. I used to work with a pediatric hospital. The moment they say, "Arey, Saksara is talking about no vaccine to be given and all that." So the word has spread. I said you have to give safe vaccines. I was telling, don't combine all the vaccines in one go. Your immune system gets jeopardized. You give 1 in 7, 1 in 5, or 1 in 6 in one shot, and you justify it telling that, "Ki I'm giving one vaccine in 6, I'm giving in only one. The child will not get that pain and all that." This is bullshit, yeah. Something is an issue, and doctors should stand up. I just came down with because I was told about this particular thing. I think I have covered the major kind of things. I'll just go with one more thing called dementia. Let us discuss what is the safest healthy vegetable oil. Somebody has to take a lead now, because what is the healthiest vegetable oil? Absolutely, yeah, absolutely. Thing is, you try to teach your patients also. That's the most important thing. I think nothing more than that. We can just simple basics, and they will thank from the bottom of their heart, and try to train them properly, and tell what are the side effects what you are getting with all this pesticides, all this, why there is a need to go for organic, what is you all know about kitchen gardens and all that. I think you all are aware about this. We need to work on your own. Here Dr. Jayachandra Mohan is my friend. He is sitting here, and Jayachandra, why did you come up here? Come here. Because I just want to introduce Dr. Jayachandra Mohan because of only one reason. Is he is a DMHO. He is in Narayan Pet. He is a DMHO. He is a graduate from Kakatiya Medical College. Did his anesthesia also, and he is the guy alone talking about from so many years. This is Dr. Jayachandra Mohan. He has done farming, organic farming, and he is not just helping his family members, he is giving for others also.
He is doing still. He is doing right now.
He is doing?
Not now. He has done.
That concept he is training for the last, and we have Sridhar also. I want you two also to join here.
Sridhar helped me out. Sridhar, come here. Sridhar helped me out on beautiful things. But I can always tell you, friends forever, because as a allopath, I started looking. I can tell you, as an allopath, we used to. There is a, you know about caterpillar line. Caterpillar line. एक जाता तो पीछे पीछे लग जाते हैं. And they were going round in circles and circles and circles. Caterpillar line, it's called like that. Look into your Google, you'll understand. This caterpillar line, if one caterpillar goes away and he breaks the line and goes away, he starts seeing, these are all, so they start looking, and these people are going around the bush again and again and again. And he starts telling about them, no, you come to our this particular stuff. So this is what is happening with medicine, and we have to keep our egos aside. We have to work it in unison. Everything is important. Naturopathy is important. Homeopathy is important. Ayurveda is important, as well as allopathy also. We are not going to. We are not interested in salesmanship and all that. We are not salesperson here. What is happening with the big hospitals and all that, I don't want to commit on that, but there is we have to be on a proper this one. So, Jai Chandra, can you just put some words? Please.
Yeah, good evening everyone. Myself Dr. Mohan, working as District Medical and Health Officer, Naranpet. So actually, we wasted, not like wasted, we spent a lot of time in getting degrees like MBBS, MD, 30-35 years. But ultimately, the truth of our journey is found to be a different one. Like, body is living thing, it doesn't require any chemicals, right? So, living thing requires only living thing to support, that's it. So, with this principle, I am able to cultivate all my needs from soaps, shampoos, all my needs, more than 90% needs, I am getting it from my farm, and surplus items, with the surplus items, I am helping my patients. So, I am like last 15 years, I never took any medicine, and including corona vaccine, right? Even though as a district medical
Corona vaccine, we all friends, we have not taken. I am also one of them, and I had told my patients not to take it.
Yeah. So it is ultimately the immunity we can develop. That's it. So immunity, there is a big topic. Sorry, is also covering with the gut microbial system, and there are a number of things we can work on the immunity. Yeah, if time permit, tomorrow I can share a few details with the consent of the NN team here. So actually we want to present one app called HIE. So tomorrow I want to present it. So thank you so much.
Sridhar has been instrumental. I used to think that he's only acupuncturist, should not mind Sridhar. But when I met him and I understood the kind of thing, here he's going to speak. He's also coming actually. So the thing is, we certainly tried to connect the people, and it was a great journey. I'm happy to the organizers. Satyanarji gave me, Satyalakshmi ji gave me that opportunity to talk here. Any questions and all that, we always have a kind of thing. You have any question? No? Sure. Yeah. If you don't have a question, I'm going to ask you a question. You have to answer that. Right? That is a fundamental. Why do males get heart attack mostly? Females are not slightly, they don't get that heart attack. Right? And why the heart attacks are only in the morning 2 a.m. to morning 4 a.m. in the middle of night? Why it doesn't happen in that? Why vitamin D is low during winters? Have any answers? Perfect, yeah. So if you are not asking, I will be asking. But that answer, I think I want you to tell. about why heart attacks and all that. Yes, sir.
Sir, you said no. The periodontitis causes heart attack. Why?
There is a kind of thing, what the bacterial, there is a kind of thing here, and you have got, when you looked into that atherosclerotic plaque, you have got the same things what you have got here. And most of the heart attacks patients, they have one week before they had some periodontitis. That's a kind of, it's a study basically. We can share you that particular stuff. So try to keep your gum healthy, smile. You have got a lovely smile. Keep smiling, you're not going to get a heart attack. The answer which I was expecting was I keep talking in general group also, general people. So one person jovial said, "Nahi sir, women doesn't keep any stress with themselves. That the moment husband comes in, they transmit everything." Do you think that